Hi, it's Barbara back at Pure Dental Care, going to teach you all how a sealant is done. Sealants are placed on permanent teeth, usually 6-year-old molars, 12-year-old molars. Sometimes, depending if the child has a lot of decay, we will also put them on premolars as they erupt. These are the instruments that I'll be using during the sealant process. Everything is pre-packaged so that everything is brand new and there's no cross-contamination with saliva. Most importantly, I will use is a mirror. We have a shepherd's hook, which will help detect whether the sealant is on properly. Air water syringe, which I will use to rinse. We have a blue jelly that is placed on to prepare the tooth. Looks like a needle, but I would never do this to a needle. It would puncture my finger. It's just for simple application because the top of the tooth is very small. Same thing with the actual sealant itself. It is not a needle. It is just for application. Sometimes I will use a small Q-tip to actually help move the sealant around. And then a light is put in the mouth to help cure it. Suction tips as well. Soft pillows are applied inside the mouth to help stop any saliva from getting on top of the tooth. Okay, the saliva ejector, Mr. Thirsty, is placed inside the mouth. The first thing that we do is we prepare the tooth open as wide as you can by polishing and remove any bacteria that might be in the grooves and the crevices of the tooth. We then rinse it off really good because you don't want to seal any remaining of the polish down in the grooves of the tooth. Open. We dry the tooth off really well. We apply the blue jelly and let it sit there for approximately 30 seconds. I'll give you a little bit of a break as soon as I rinse this off. Next, we apply the soft pillow in the side of the mouth because you actually want to make sure that the tooth stays dry. The next thing I do is I apply a cotton roll because I'm working by myself. So I need the area dried as much as possible. Air is applied to make the tooth dry. If it gets wet with saliva, the sealant will pop off, so we want to keep the area as dry as possible. The sealant is then applied just like drawing. And the light is applied to dry the sealant. And that's how the sealant is applied.
When I first came in and I saw all this stuff, I thought a lot of them were needles and it really scared me. But once we did the process, it wasn't so bad. Even though my mouth was kind of dry and I felt all the feelings, I kind of felt better after.